Welcome to Livo, a first step toward a brighter future for those suffering from substance addiction.
Every 5 minutes, another person in the U.S. passes away from a drug overdose. That's over 300 lives lost each day, and more than 100,000 deaths in the past year. The reality is devastating. Most overdose victims never have someone there to call for help, and it costs them their lives. Despite growing awareness, current prevention methods fail when they're needed most, relying on bystanders to recognize an overdose, quickly react, and call for help.
Even advanced check-in apps like Canary require manual responses, becoming useless if the person is already unresponsive. Similarly, AI-based models like iHeal, while innovative, suffer from slow response times and inconsistent accuracy. The overdose crisis demands a solution that is immediate, reliable, and independent of bystander intervention.
That solution is Livo, a revolutionary wearable that detects an overdose the moment it happens and instantly calls for help. So, how does Livo actually work? Here's a breakdown.
Individuals first secure Livo to their arm. Once activated, 3 integrated biosensors continuously monitor key physiological metrics: temperature, sweat, and movement patterns. This data is then transmitted to a secure cloud server, where our proprietary machine learning model analyzes it for signs of overdose. With 98.5% accuracy and sub-5 second runtimes, detection is both rapid and precise. Upon identifying an overdose, Livo automatically triggers an emergency response, contacting local emergency services and notifying designated contacts. This ensures responders arrive in time to administer life-saving treatments such as Narcan. Additionally, all collected data is securely stored in compliance with HIPAA regulations, and users can access their health data anytime via the Livo app, which also provides insights into device health and emergency contact settings.
But Livo isn't just effective, it's transformative. Unlike Canary, it requires no manual input, functioning passively and autonomously. Moreover, unlike iHeal, Livo's machine learning backend is significantly faster and more accurate, utilizing a random forest architecture for near instantaneous response times.
Furthermore, the need for Livo is undeniable. According to the CDC, over 10 million Americans misuse drugs every year, with this number continuously growing. While individuals with substance use disorders face the highest risk, the danger also extends to the over 16 million prescribed users, such as post-surgical patients, chronic pain sufferers, and those new to opioid treatment, who are often unaware about how easily an accidental overdose can occur. With over 100,000 opioid-related deaths annually and millions more at risk of falling into misuse or overdose, the necessity for Livo has never been greater.
Confronting this urgency requires not just innovation, but proven efficacy. Rigorous testing demonstrates Livo's superiority. It detects overdoses with 98.5% accuracy and triggers emergency responses in just 7.8 seconds. Competing systems like iHeal detect only 79.8% of cases, with a fatal 26.4 second delay. Beyond speed though, Livo significantly improves outcomes. Statistical analysis shows it boosts intervention rates by 87.2% and increases successful recoveries by 43.6% compared to conventional emergency response systems. The numbers speak for themselves. Livo is not just an improvement, it's a breakthrough in overdose prevention.
To bring Livo to market, we have secured $500 in initial funding from the Bagel Microgrant Fund and begun the patent process. Our next step is launching a $250,000 crowdfunding campaign, combining equity and donation-based funding to sustain operations through Q3 2025. During this phase, we'll roll out an early access trial in collaboration with addiction treatment centers, harm reduction groups, and healthcare providers. Additionally, we're pursuing partnerships with medical device manufacturers and nonprofits, a necessary step to expand our reach.
Livo's cost structure prioritizes affordability and sustainability, with manufacturing costs optimized at $35.75 per unit and a retail price of just $55, ensuring a 35% profit margin. Profits will be reinvested into research and development and scaling. By Q1 2027, we plan to secure long-term contracts with public health agencies, insurers, and healthcare networks to ensure broad access. Looking ahead, our strategic vision includes an acquisition by a major medical technology or pharmaceutical company by Q4 2030, enabling Livo's life-saving technology to achieve maximum impact on public health.
Most importantly, Livo is driven by a passionate and highly skilled team.
I'm Shashank Hodi, CTO, and I was one of 136 students selected to present at the National STEM Festival for my invention, an AI-powered bus tracker called RideWise.
I'm Tanish Bangera, CMO, and I have experience in designing, building, and programming autonomous machine learning UAVs.
And I'm Cross Hanna, Chief of R&D. With a strong foundation in biology, hosted competition experience, and real-world community interactions, I have a deep understanding of the health metrics and testing processes behind Livo.
Together, our expertise drives Livo's mission. As the first always-on safety net for drug overdose prevention, Livo's not just another gadget, it's a lifeline.
When every second counts, Livo ensures help is already on the way.